Well, here are some highlights from the Center for Disease Control regarding the coronavirus. Let's listen in.
The majority of the Italians who succumbed to this had 3 or more comorbidities. So this has been known from the beginning. So those individuals will have an underlying condition, but that underlying condition did not cause their acute death when it's related to a COVID infection. In fact, it's the opposite. Having an underlying condition and getting this virus, we know, is particularly damaging to those individuals. We don't know all the pathophysiology. I wish we did right now. We see a lot of vasculitis where Tony and I came from. Tony actually, Dr. Fauci started in the vasculitides and Wegener's. So, I mean, these are things we have studied for a long time. We are trying to understand the pathophysiology, but what we can tell you at this moment, if you have asthma, if you have renal disease, if you have diabetes, if you have hypertension, these are pre-existing conditions that put you at a greater risk to having a worse outcome.
So, Jim, just to add a comment to that, because, you know, having been through other serious issues, particularly the very painful early years of HIV, AIDS, when people talk about conspiracy theories, you will always have conspiracy theories when you have very challenging public health crises. They are nothing but distractions. You know, I can assure you we have so much to do to protect the health and the welfare of the American people that I would just hope we just put those conspiracy stuff and let somebody write a book about it later on, but not now.
And so we've put out a new guidance for essential healthcare workers who've been exposed to the coronavirus. These are individuals that have been within 6 feet of a confirmed case or a suspected case, and so that they can, under certain circumstances, they can go back to work. If they're asymptomatic, as the Vice President said, they could go back to work if they do several things, as we say here. Take their temperature before they go to work, wear a face mask at all times, and practice social distancing when they're at work. What we'd ask them not to do while they're at work is we want them to stay at home if they're sick. We want them not to share objects that would be touching their face, and we would like them not to congregate in break rooms, lunch rooms, and crowded places. And in the second slide, if we're talking to the employers of these critical industries, we would ask those employers to take the employee's temperature and assess their symptoms before starting them back to work. If the employee does become sick, we want them to be sent home immediately. We'd like them to increase air exchange in the buildings and increase the frequency of how they clean common surfaces and really begin to get these workers back into the critical.
Meanwhile,